Thank you, Cynthia. Regulation is needed, but it's not enough. As much as we appreciate Representative Miller's efforts in introducing H.R. 911 and the bill's efforts to stop child abuse and neglect in residential programs, we would like to address how this bill does not deal with the issue of whether a particular form of residential treatment is either therapeutic or appropriate, and how we as a community can address these issues on a grassroots level. While it is easy to identify practices that are clearly abusive, as the stories that Nick, Kat, Paul, Crystal, and Chris shared with us clearly demonstrate, there is a gulf between what research tells us is effective treatment and the actual practice of at least some residential programs. Research done on Wraparound Milwaukee, one of the most well-known and cited systems of care projects, identified these principles when it comes to using residential care as a best practice. Number one, residential treatment is part of the continuum in systems of care. Number two, residential treatment should be short-term, anywhere from 30 to 90 days. Targeted behavioral and mental health needs should be the focus of residential treatment. Number four, care planning should remain with the child and family team and not switch to a different team that just focuses on the residential treatment. Number five, family involvement should be supported and families should be drivers of the plan, and youth should have the opportunity to guide the plan. Number six, the outcomes for the residential treatment stay should be very clear and time limited. And number seven, residential treatment centers should provide a broader continuum of care. These are widely accepted principles that are shared not just by community-based service providers, but by the same residential providers that came out in support of H.R. 6358, including the Child Welfare League of America and the American Association of Children's Residential Centers. However, not everyone feels that residential treatment should be short-term, individualized, and targeted. Take CRC Health, for example. CRC Health is the largest private behavioral health agency in the country. Aspen Education Group, which has been mentioned several times already today, is their subsidiary which runs their residential programs for youth. The following is taken directly from their website. CRC Health's youth division consists of therapeutic and educational programs for children and adolescents struggling with academic, emotional, and behavioral issues that have hindered their success at school or at home, whether a child is confronted with learning disorders, ADD, ADHD, Asperger's syndrome, or high-functioning autism, or is displaying defiance, low self-esteem, anger management issues, negative peer relationships, adoption issues, or depression. CRC has a program that can help. CRC has a program that can help. Name the program and they have a solution. They even have weight loss camps that you can send to for a couple of months that'll cost you about a couple $1,000s a month.